The first human came through the airlock missing most of his right arm, and Surgeon Ascendant Valeth of the Toranni Medical Corps dropped the practice tourniquet she had been demonstrating to her students. It was supposed to be a drill. Outpost Kethsaran, a joint species medical station on the fringe of the Damara corridor, had been running its annual mass casualty simulation when the real distress beacon cut through the exercise channel like a blade through silk. A Terran convoy, 3 transports, and a light escort had triggered a derelict minefield left over from the Keth Dissolution War. The mines were 70 years old. They worked fine. Valeth's 4 secondary hands were already moving before her brain caught up. She stripped the simulation tags from her triage bay, kicked the practice mannequin off the nearest gurney, and pointed 2 of her students toward the intake corridor. Her primary hands, the large, triple-jointed ones that had made her the finest field surgeon the Toranni had produced in a generation, pulled sterile wraps from the overhead rack. "This is no longer an exercise," she said. Her voice carried the flat calm her instructors at the ascending halls had drilled into her since before she had her adult ridge plates. "Flush the simulation tags, strip every bay. We are receiving live casualties in," she glanced at the intake clock, 4 minutes. Kethsaran had 40 beds. Valeth had 12 staff, half of them students on their practicum rotation. The convoy's distress beacon reported 109 surviving crew across 3 crippled transports, and the escort frigate was already dark loss of all hands. She had never treated a human before. That thought arrived and she pushed it down hard, because the airlock was cycling and the smell hit first. Copper and char and something organic that the Toranni olfactory ridge processed as wrong. Human blood did not smell like Toranni blood. It smelled heavier, wetter, iron-thick in a way that coated the back of her throat. The man with the missing arm was conscious. That was the first impossible thing. He was upright, leaning on a woman whose face was a mask of burned gel and determination. She had one eye swollen shut, and she was carrying a child in her other arm, not her own. The child was too small, maybe 3 standard years, and clinging to her neck with both fists. Behind them came more. Walking wounded, stretcher cases, people dragging people. They filled the intake corridor in a tide of field dressings and tourniquets and sheer refusal to stop moving. "Surgeon," her student Rithea called from the triage station, and the panic in the young Toranni's voice was naked. "The scans, their biology, I don't have baselines for any of this." Valeth crossed the bay in 4 strides. Her ridge plates flared involuntarily, a Toranni stress response she had spent 20 years learning to suppress. She looked at the medical scanner's readout for the one-armed man and saw numbers that made no sense. His heart rate was 140. His blood pressure was low enough that a Toranni would have been unconscious. His body temperature was 37 degrees of fever by Toranni standards, but the database flagged it as normal for his species. Normal. He was missing an arm, and his vitals were normal for a species that apparently ran at combat temperature all the time. "Forget the baselines," Valeth said. She placed her primary right hand on the man's shoulder. His skin was hot, not feverish hot, species hot, as if someone had lit a furnace inside him and he had simply learned to live with it. "What is your name?" "Warrant Officer Dree Colton," he said. His voice was steady, which was the second impossible thing. "Ma'am, I need you to know there are still people on transport too. The hull is holding, but the med bay is gone. I count 30+ wounded who can't move." He was missing an arm, and he was giving her a casualty report. Valeth held his gaze. His eyes were brown, a color that did not exist in Toranni genetics, and they were clear. Not the glaze of shock, not the disconnection of a body shutting down. Clear. "Rithea," Valeth said without looking away from the human. "Prep Bay 1. Hemorrhage protocol, adjusted for a closed circulatory system with iron-based oxygen transport. The stump needs a pressure seal, not a regeneration cradle. Their tissue does not regenerate at our speed. Move." Rethea moved. Valith guided Colton to the gurney herself. He sat down heavily, and for the first time she saw his jaw clench, a pain response he had been hiding. She found the tourniquet on his upper arm. It was made from a belt, not a medical tourniquet. A belt, cinched so tight the leather had cut into his skin, with the time of application written on his forearm in his own blood. She stared at it. "Field expedient," Colton said. He almost smiled. "We train for this." "You train for losing limbs." "We train for everything going wrong at once." Valith sealed his stump with a bioplastic sheath and a hemostatic compound. She had to reformulate on the fly because his blood clotted differently than any species in her pharmacopoeia. His red blood cells were smaller than Toranni cells, more numerous, carrying oxygen on iron molecules instead of copper. His plasma was different. His clotting factors were different. Everything was different, and none of her training had prepared her for any of it. But her hands knew what to do. Anatomy varied, the principles did not. Stop the bleeding, manage the pain, stabilize and move on. She stabilized Colton and turned to the burn gel woman, the one who had carried both the child and the one-armed man through the airlock. Her name was Sergeant Lyra Vasquez, and she had second-degree burns across her face, neck, and left shoulder from an electrical fire in the transport's power distribution node. She had extinguished the fire with a blanket, then carried 2 people out of the compartment before the suppression foam sealed the corridor. Valith treated the burns with a broad-spectrum antimicrobial gel and began debriding the dead skin. Vasquez sat motionless during the procedure, her one good eye fixed on the triage bay's far wall. "The gel I am using is formulated for Toranni skin," Valith told her. "It may cause minor irritation. I will adjust for your species' histamine response as I learn more." "It's fine, Doc." "You are the 3rd person in the last 10 minutes to use that word when describing a condition that is objectively not fine." Vasquez's burned face attempted a smile. "Welcome to humans." Valith moved through the intake line with a speed that surprised even her own students. She was learning with every patient. Every human body was a textbook she had never read, and she was writing the annotations in real time. Their muscles were denser than expected, which made injections harder. Their pain responses were inconsistent. Some patients screamed at minor injuries, while others sat silent through procedures that should have been excruciating. Their adrenaline surges were powerful enough to mask injuries that would incapacitate other species, which meant that the patients who looked fine were sometimes the most dangerous. The intake corridor had become a war zone. 40 beds, 63 casualties in the first 20 minutes with more coming. Her students were working in pairs, one scanning, one treating, and she could see the terror on their faces. Toranni ridge plates did not lie. Every one of them was flared, stress hormones painting their neck crests a deep violet. Valith walked the line. She corrected a splint on a human woman whose fibula had shattered in 3 places. She adjusted an oxygen mix for a human man whose lungs were filling with fluid from a chest compression injury. Human lungs were astonishingly elastic, but they bruised internally, and the fluid buildup was something she had to reason through from first principles, because the textbook for this species had a chapter and a half in the Galactic Medical Index, and most of it was warnings. The warnings were not about how to treat humans. They were about what humans could survive. Fractured spine, still conscious, still talking, still giving orders to the person on the next gurney. Degree burns across 40% of the body. Awake, coherent, asking for water. A woman with a shard of hull plating embedded in her thigh, who had carried 2 unconscious crewmates through a depressurized corridor before anyone found her. She had sealed the breach with her own emergency suit, which meant she had spent 11 minutes in partial vacuum. Her capillaries had burst across her face and arms. She looked like she had been beaten. She had done it to herself deliberately to save 2 strangers. Valith treated her and said nothing, because there was nothing to say. The child, the 3-year-old who had come in clinging to the Burngel woman's neck, was uninjured. Physically. She sat on a cleared countertop in the supply alcove, knees drawn to her chest, watching the triage bay with eyes that had gone flat and distant. One of Valeth's students, a young male named Thesic, had tried to approach her. She had not screamed or cried. She had simply pulled away with a precision that suggested she had learned, very recently, that adults could not always be trusted to keep her safe. Valeth watched this from across the bay while simultaneously debriding a laceration on a man's scalp. She did not know what human children needed. She did not know if the flat affect was shock, trauma, or simply how their young processed catastrophe. What she knew was that the child's hands were steady, her breathing was regular, and she had not made a sound since arriving. When Valeth finished the scalp laceration, she crossed to the supply alcove, lowered herself to the child's eye level, and held out her smallest secondary hand, the one that was closest in size to a human adult's hand, though the joints bent differently. The child looked at it. Then she reached out and wrapped her fingers around Valeth's thumb. Her grip was surprisingly strong. "I am Valeth," the surgeon said. "You are safe here." The child said nothing, but she did not let go. Valeth worked the next 12 minutes one-handed, her secondary left still anchored to the child, because she had made a promise and breaking it was not something the Toranni medical oath permitted, even when the promise was only a thumb. It was Colton who resolved it. He appeared one-armed, gray-faced, technically her patient, and knelt beside the child with a familiarity that suggested he knew her. "Hey, Myra, I need you to let the doctor work, okay? She's got people to help." The child Myra looked at him. "You're hurt." "Just a scratch." "Your arm is gone." Colton glanced at his stump. "Well, a big scratch." He looked at Valeth. "She's Ensign Dahar's daughter. Dahar's on transport too. One of the 31 wounded. One of the 14 critical." The child's parent was on a dying ship, and the child was here, holding an alien surgeon's thumb on a station that smelled like iron and fear. Myra released Valeth's hand and climbed into Colton's lap, his one-armed, blood-crusted, should-be-on-a-gurney lap. She buried her face in his chest and was silent. "I'll keep her," Colton said. Valeth nodded and went back to work with both hands free, and something in her chest that she could not name tightened and did not release. By the 40-minute mark, Kethsaran was full. Every bed occupied, every corridor lined with field cots, every treatment bay converted. Valeth's students were performing procedures they had only simulated that morning. The irony was not lost on her. "Surgeon Ascendant." The voice came from the station's communication officer, a nervous Toranni named Pelesh who had been handling logistics from the operations center. "Transport 2 is requesting immediate surgical support. They have wounded who cannot be moved, internal injuries, spinal trauma. Their own medical officer is dead." Valeth looked at her triage bay. Every surface was occupied. Her students were stretched to breaking. She had been on her feet for less than an hour, and she had already performed more emergency procedures than in her last 5 rotations combined. "How many on transport 2? 31 wounded. 14 critical. 14 critical casualties on a crippled ship with no medical officer, no functioning med bay, and a hull that was holding through what Valeth suspected was spite. "I need a shuttle and a field kit," she said. Pelesh hesitated. "Surgeon, the minefield is still partially active. Navigation has plotted a safe corridor, but—" "Then I will take the safe corridor, prep the shuttle." She designated Rithea as acting surgeon in her absence. The girl's ridge plates went nearly white, and for a moment Valeth saw the student she had been training for 8 months, talented, precise, but untested in anything that bled. "Rithea." "Yes, Surgeon Ascendant." "You know the protocols. You have been performing them correctly all morning. The only difference between the drill and now is that the blood is real. Valith placed one of her secondary hands on the student's shoulder. "You are ready. I would not leave if you were not." Rthea's ridge plates slowly settled back from white to their natural blue-gray. She nodded. Valith grabbed the largest field kit the station had. She opened it on the corridor floor and inventoried it in 45 seconds. Hemostatic compounds, bioplastic sheaths, suture arrays, analgesics, splinting materials, 2 portable scanners, and a resuscitation unit, all calibrated for Toranni physiology. The hemostatic compounds were designed for copper-based blood. The analgesics were dosed for a body mass and metabolism that bore no resemblance to a human's. The scanners had baseline profiles for 12 species, and Terran was not among them. She packed the kit anyway and added everything from the station's emergency cabinet that might have cross-species utility: broad-spectrum antiseptics, sterile water, universal adhesive strips, and a thermal regulation blanket that could operate across a 30-degree temperature range. She also grabbed a datapad loaded with the Galactic Medical Index entry for species 7702, Terran, the chapter and a half that was supposed to be enough. It was not going to be enough. She knew that already, but she took it because even bad information was better than none. At the shuttle, she found Colton standing by the ramp. He was upright, one arm, blood still drying on his uniform. The bioplastic sheath she had applied to his stump was already showing strain because he had been using his shoulder to help load supplies. "What are you doing?" Valith said. "Coming with you." "You are a patient." "Ma'am, my people are on that ship. I know the layout, I know the crew, and you have never operated on a human before today." He paused. "Respectfully, you need me more than that gurney does." Valith studied him. The Toranni had a saying, "Read the marrow, not the bone." It meant look past what a person showed you to what held them upright. She read Colton's marrow and found something she did not have a Toranni word for. Not courage. Courage was a decision. This was deeper. A refusal to stop functioning that seemed woven into his biology, as firmly as his iron-blooded cells. "Get on the shuttle," she said, "and if you collapse, I am not carrying you." "Fair enough." The shuttle crossed the debris field in 12 minutes, and every one of those minutes taught Valith something new about what humans had already endured. The navigation plot threaded between mind signatures dormant but not dead, the Kethira weapons still cycling through their activation patterns like old machines that had forgotten they were supposed to stop. The shuttle's pilot, a Toranni named Riska, who normally ran supply routes, kept her primary hands locked on the controls and her ridge plates sealed flat. Valith watched through the viewport. The convoy's path was written in wreckage. Transport 1 had taken a glancing hit that stripped away its port cargo bay. The bay's contents: supply crates, personal effects, a child's sleep harness still strapped to a fragment of bulkhead drifted in a slow expanding cloud. Transport 3 was intact but venting coolant from a ruptured line, and its crew had positioned it as a shield between the debris field and Transport 2. They had positioned their ship as a shield, voluntarily. The crew of Transport 3 had taken their damaged, leaking vessel and put it between the minefield and the ship that could not move. Then they passed the escort frigate, and Valith stopped breathing. It was not a ship anymore. It was a memorial made of metal. The frigate had taken the first 3 mine strikes in sequence, each one meant for the transports behind it. The scorch patterns told the story. The frigate had turned into the field, presenting its broadside to absorb the detonations, buying the transports the seconds they needed to reverse thrust. The captain of that frigate had pointed the bow toward the mines and accelerated. "All hands lost. 38 crew," the beacon said, before it went silent. 38 humans who had driven their ship into a killing field so that civilians could live. The wreckage was backlit by the system's pale sun, and the light caught the frozen atmosphere that still clung to the hull in translucent sheets, turning the debris into something that looked almost sacred. Valith filed that in the part of her mind that she would deal with later, when there was time for grief that was not hers to carry. She turned from the viewport and checked her field kit one more time, running her secondary hands over the instruments while her primary hands composed a mental list of every procedure she might need and the Toranni equivalents she would have to adapt. "Surgeon," Colton said from the seat beside her. He had not looked at the frigate, he knew what was there. "Ensign Dahar Myra's mother, she's a structural engineer. If she's conscious, she'll have kept the ship together from the inside. Look for welding burns on her hands." "You know all of them." 84 crew, I know every name." He paused. "I knew every name." Past tense. Because 38 of those names were now frozen in the debris field behind them. Transport 2 was a civilian freighter pressed into convoy service, a bulk hauler named the Kieran Mace, originally designed to carry agricultural equipment between colony worlds. It was never meant to carry this many people, and it was never meant to take a mine blast to its ventral section. The lower 4 decks were open to space, the hull peeled back like skin from a wound, structural beams twisted and frozen in the attitudes of their destruction. The upper decks were sealed, pressurized, and filled with the sound of people trying not to die. As the shuttle docked, Colton told her what to expect. His voice had the cadence of a man delivering a briefing, clipped, organized, economical with emotion. The Kieran Mace had taken the mine strike at 3:51 station time, 6 minutes after the escort frigate's sacrifice bought the transports their window. The blast had killed the ship's medical officer, Chief Surgeon Hollander. Instantly, she had been in the ventral med bay when the deck disintegrated. It had killed 9 other crew. It had wounded 31. And it had left the survivors sealed in the upper decks with no medical facilities, no functional communications until someone had rigged a backup transmitter from parts of the navigation console, and a hull that was holding together through emergency welds and structural patches applied by people who were themselves bleeding. Hollander was good, Colton said. His voice did not change, but something behind his eyes shifted. Best doctor in the convoy. She would have saved everyone. "I will do my best to honor that standard," Valith said. Colton looked at her for a moment. Then he nodded once, and the shift behind his eyes settled into something that might have been trust. Valith came through the docking collar and into a corridor lit by emergency strips. The air was thinner than standard, the life support was failing, bleeding atmosphere through microfractures in the hull. She adjusted her breathing and felt her secondary lungs compensate. Humans did not have secondary lungs. They were breathing this reduced atmosphere on a single pair of organs and doing it without complaint. The makeshift triage area was the ship's cargo hold. Someone had cleared the crates and laid out blankets and emergency tarps. The wounded were arranged in rough rows, an attempt at triage by someone who had basic training, but not the expertise for this. Colton walked her through it. Chief Petty Officer Vasari blast trauma, probable internal bleeding. She has been in and out of consciousness for 30 minutes. He pointed with his remaining hand. Crewman Holt spinal injury, cannot feel his legs, we have not moved him. Ensign Dahar structural engineer, broken ribs and a punctured lung from a beam collapse. She welded 3 hull fractures shut after the blast before she went down. Ensign Park, both hands burned to the bone when she manually closed the plasma relay to keep the upper decks pressurized. Valith found Dahar first. The woman was lying on a makeshift stretcher near the bulkhead, her breathing shallow and uneven, a crude chest seal made from packaging tape, and a ration wrapper covering a wound on her left side. Someone had immobilized her ribs with strips of cargo netting. Her hands, Colton had been right, were covered in welding burns, the skin blistered and cracked in the pattern of someone who had gripped a welding torch for far longer than was safe. Ensign Dahar, Valith said, kneeling beside her. "I am Surgeon Ascendant Valith. Your daughter is safe at Kethsaran. She is uninjured." Dahar's eyes focused. They were dark like Colton's but glazed with pain. "Myra." "Safe. I treated her myself." This was not entirely accurate. The child had not needed treatment, but the intent was true, and Dahar's breathing eased fractionally. The punctured lung was Valeth's most complex challenge yet. Toranni lungs repaired organs with redundant lobes. A puncture in one was serious but survivable because the other 3 lobes compensated. Humans had 2 lungs, no redundancy, and when one collapsed the other had to carry the entire respiratory load. Dahar's left lung had a tension pneumothorax. Air was leaking from the puncture into the pleural space, compressing the lung and pushing against the heart. Valeth needed to decompress the chest. She had a Toranni thoracic needle, which was too thick for human intercostal spacing. She looked at her kit, looked at the cargo hold, and found the solution in a length of thin-gauge tubing from the ship's hydraulic repair stores. She sterilized the tubing, fashioned a one-way valve from a section of surgical glove, and inserted it between Dahar's ribs at the second intercostal space. The hiss of escaping air was immediate. Dahar gasped, coughed, and breathed deeply for the first time in what Valeth estimated had been over an hour. "Better?" Valeth asked. "Much." Dahar's voice was hoarse but steady. "Tell Myra I'm coming home." "I will." Valeth moved on. She found Ensign Park next. Valeth looked at Ensign Park. The young woman was sitting against a bulkhead with her hands wrapped in what appeared to be strips of someone else's uniform shirt. Her hands were destroyed. The burns went through the dermis, through the fat layer, to the tendons. In a Toranni, this would be a career-ending injury requiring months of regenerative therapy. Park was sitting upright and her eyes were dry. "She closed the relay by hand," Valeth said. The remote actuator was destroyed in the blast. It was close it by hand or lose atmosphere on decks 3 through 6. Colton's voice was matter-of-fact. 41 people on those decks. 41 people alive, because a woman had grabbed a superheated plasma conduit with her bare hands. Valeth knelt beside Park and began unwrapping the makeshift bandages. "Ensign. I am Surgeon Ascendant Valeth of the Toranni Medical Corps. I am going to treat your injuries." Park looked at her. "Can you save my hands?" Valeth examined the damage. The tissue destruction was severe. In a Toranni, no. In a human, she consulted the thin chapter in the Galactic Medical Index and found a note that said, in clinical language, that human tissue demonstrated anomalous regenerative persistence in extremity trauma cases. "I do not know," Valeth said. Honesty was a Toranni medical oath. "I will do everything I can." "Okay," Park nodded. She did not cry. She did not scream. She sat still and let Valeth work, and the only sign of pain was a rhythmic clenching of her jaw that matched her heartbeat. Valeth debrided the dead tissue, applied a regenerative scaffold modified for human cellular density, and wrapped both hands in bioplastic sheaths infused with a growth factor. She had to calculate from scratch, because no one had ever documented the correct dosage for human extremity burns. She moved to the next patient. A man named Ortega with a compound fracture of the femur. The bone had punched through the skin, and the surrounding muscle was swelling rapidly. On a Toranni, the treatment was straightforward: bone realignment, tissue regeneration, anti-inflammatory infusion. On a human, the bone was denser than she expected, and the muscle tissue was more vascular. When she manipulated the fracture, blood welled up in quantities that alarmed her until Colton, watching from 3 meters away, said, "That's normal. Femoral area bleeds heavy. You're doing fine." Fine. She was reassembling a broken human leg on the floor of a cargo hold with tools designed for a different species, and the patient's crewmate, the one missing an arm, was telling her she was doing fine. She set the bone, splinted it with cargo struts padded with strips of thermal blanket, and moved on. A woman named Chen who had chemical burns from a ruptured coolant line. The coolant was an alkaline compound that had reacted with human skin in ways Valeth had never seen. The burns were white, not red, and the tissue underneath was liquefying. Valith flushed the burns with sterile water, applied a neutralizing compound she mixed from the ship's chemical stores and her own pharmaceutical kit, and dressed the wounds with the last of her bioplastic sheaths. A teenage boy and apprentice, barely old enough to be on a convoy, who had a concussion and kept trying to get up because he thought he should be helping. Valith sat him down 3 times before Colton knelt beside him and said quietly, "You help by letting the dock work. That's your job right now." The boy stayed down. And the next and the next. The cargo hold became her operating theater. Colton became her translator, not of language. The universal translators handled that, but of bodies. He told her which grimaces meant real pain and which were humans being stubborn. He told her when someone's color was wrong. She could not read human skin tones the way she read Toranni ridge plates, but he could. He told her that the crewman who kept saying, "I'm fine," was the one she needed to check first, because humans lied about their own damage with a consistency that bordered on species-wide pathology. "Why?" Valith asked between patients, her secondary hands preparing a suture kit while her primary hands stabilized a collapsed lung. "Why do they deny their injuries?" Colton considered this with the seriousness of a man who had never thought about it before. "Because if you admit you're hurt, someone has to stop and take care of you. And if they stop, they're not helping the next person." Valith tied off the suture. "That is the most irrational thing I have ever heard." "Yeah," Colton said, "it's also why we're still alive." She could not argue with the results. 3 hours in, the situation on Transport 2 deteriorated. The hull microfractures widened. Atmospheric pressure dropped another 8%. Valith's Toranni physiology could compensate. The wounded humans could not. She watched oxygen saturation levels fall across her patients and felt the cold mathematics of triage close in around her. "We need to evacuate," she told Colton. "The hull is failing. We can't move Holt or Vasari. Moving them could kill them. Staying here will kill them with certainty." They looked at each other across the cargo hold, the alien surgeon with 6 arms, and a species that had evolved for patience, and the one-armed human warrant officer who seemed to be held together by sheer obstinacy. Between them lay 31 wounded people who had already survived things that should have killed them. "Then we don't evacuate," Colton said. "We seal this compartment and we hold." "Hold how? The atmospheric processors are failing." Colton turned to the able-bodied crew, 4 of them, all walking wounded who had refused to be classified as patients. "Wren, Kowalski, get to the processor relay on deck 2. It took shrapnel, but the primary coil should be intact. Bypass the secondary and run it direct." "That'll burn it out in about 6 hours, said the one called Wren. "Then we have 6 hours, move." They moved. Valith watched them go, injured people, bleeding people, running toward the most damaged part of the ship to perform a repair that would keep the air flowing for just long enough. She turned back to her patients and kept working. In the 3rd hour, Valith noticed something that stopped her between patients. The humans were organizing themselves. Not by rank. The ranking officer aboard was unconscious, and the next in line had a broken jaw and could not speak. They were organizing by capability. The walking wounded who had engineering skills had formed a damage control party and were reinforcing the weakest hull sections under Dahar's shouted instructions. The ones with medical training, even basic first aid training, had positioned themselves at the treatment tarps as Valith's assistants, handing her instruments, holding patients still, monitoring the crude vital signs they could check without scanners. The ones who could do neither were doing the only thing left, talking to the wounded, holding hands, telling stories, keeping people conscious. Colton had not directed any of this. When Valith asked him, he looked surprised. "Their crew," he said, as though that explained everything. Perhaps it did. The teenage apprentice she had told to sit down was now running a water distribution circuit, bringing cups to every patient who could drink. He had a concussion and a limp, and he was moving through the cargo hold with the methodical efficiency of someone who had found his purpose. In the 4th hour, she lost one. A man named Garrett, who had a splenic rupture she could not repair with the tools she had. She needed a hemostatic clamp designed for human-gauge blood vessels that were smaller and more numerous than anything in her kit. She improvised with a Toranni microclamp modified with sterile wire from the ship's electrical stores, but the vessel wall was too fragile. It tore. Garrett bled internally faster than she could compensate, and he died with his hand in the hand of the woman on the next tarp. Valith stood over him and felt her ridge plates settle flat against her skull, the Toranni expression of grief that she had been trained to suppress in front of patients. Colton appeared beside her. He said nothing for a moment. Then, "You did everything you could." "I lacked the correct instruments." "You had instruments for a species you've never treated. You kept him alive 3 hours longer than he should have lasted. That's not failure, surgeon." Valith looked at him. On Toran, a surgeon who loses a patient enters a period of reflection. It is. "Respectfully, surgeon, you have 30 patients who are still alive and the air is getting thin. Reflect later." He was right. She hated that he was right, and she went back to work. The 5th hour brought a new crisis. Chief Petty Officer Vasari, the internal bleeding case, crashed. Her blood pressure bottomed out, and her heart went into a rhythm that Valith's scanner identified as ventricular fibrillation, a human cardiac emergency that the Toranni Medical Library described in exactly 2 paragraphs, neither of which included treatment protocols. "Colton," Valith's voice carried across the hold. He was there in seconds, one-armed and gray-faced and steady. "Her heart, it is fibrillating. I have no defibrillation equipment rated for human cardiac tissue." Colton looked at Vasari. He looked at the equipment. Then he looked at the overhead power junction, where the emergency lighting was wired. "How many joules?" he said. "I do not." "How many joules to restart a human heart? You have the data." Valith pulled it from the medical index. "Between 100 and 200, biphasic waveform preferred." Colton was already pulling a cable from the power junction, stripping the insulation with his teeth because he had one hand and no time. "This junction runs at 48 volts. I can rig a capacitor discharge from the shuttle's emergency power cell. Ren left me one. Crude, but it'll deliver." "You want to electrocute your crewmate with a modified power cable." "I want to defibrillate my crewmate with available resources. There's a difference." He rigged the device in 4 minutes. Valith applied conductive gel from her kit, not the right formulation for human skin, but close enough, and placed the improvised leads where the medical index indicated. She charged the capacitor. "Clear," Colton said, and the humans in the hold who were conscious all looked away, not from fear, Valith realized, but from a ritual familiarity with this act that spoke to something deep in their collective experience. They had all trained for this. Every one of them knew what the word meant. Valith discharged. Vasari's body arched. The scanner screamed an alert, then recalibrated. Valith watched the cardiac rhythm resolve from chaos into something approaching order, not perfect, not stable, but a heartbeat where there had been none. "Again?" Valith asked. "Wait." Colton watched the monitor. 10 seconds, 20. The rhythm held, irregular, damaged, but holding. "She's back." Valith's secondary hands were shaking. She locked them against her sides and breathed. "Surgeon," Colton said quietly, "that was good work. That was barbaric. That was medicine with what we had. Same thing sometimes." By the 6th hour, Wren and Kowalski had the atmospheric processor running on its bypass. The air quality stabilized. Barely oxygen levels hovered at 82% of standard, enough to sustain consciousness, but low enough that every breath felt shallow. The temperature in the cargo hold had dropped to a level that made Valith's ridge plates ache Toranni were warm-blooded but cold-sensitive, and the cold was creeping into her joints with a persistence that reminded her why she had chosen a station posting over a shipboard career. The humans did not complain. Several of them, she noticed, had given their thermal blankets to the more seriously wounded, choosing to shiver rather than let someone else be cold. The apprentice had organized the blanket redistribution without being asked a triage of warmth, prioritizing the patients whose core temperatures were dropping fastest. She asked Colton about this. He shrugged with his remaining shoulder. "We take care of each other. You are a species of irrational self-sacrificers. We prefer the term team players." Valith noted that Colton's own lips had turned a shade of blue she had learned to recognize as early hypothermia. He had given his thermal blanket away 2 hours ago. She did not ask who he had given it to because she already knew the answer, whoever had needed it more. She pulled the thermal regulation blanket from her field kit, the one she had packed for herself, for the cold of the cargo hold, and draped it over his shoulders without a word. He looked at her. He did not argue. That, more than anything else in the last 6 hours, told her how close to the edge he actually was. In the 7th hour, the rescue ships arrived. Valith heard the communication first, a burst of static on the emergency channel, then a voice identifying itself as the UENS Resolute, Terran Navy medical frigate, responding to the convoy's distress beacon with a full surgical team and evacuation capacity. She watched the cargo hold's reaction. The walking wounded straightened. The woman next to Garrett's body closed her eyes and put her hand over her mouth. Crewman Holt, who had not felt his legs in 7 hours, said, "About damn time," and someone near him laughed, a short, broken sound that was not really laughter but was not really crying either. Colton sat down on an empty crate. It was the first time he had sat down since boarding the shuttle. His face was the color of ash, and his stump was bleeding through the bioplastic sheath. "Colton," Valith said, "your sheath is compromised. You are bleeding." "I know." "How long?" "About 2 hours. 2, she stopped herself. She crossed the hold, knelt beside him, and resealed the sheath with hands that were practiced now in a way they had not been 7 hours ago. She knew the density of human tissue. She knew the clotting speed, the tensile strength of the skin, the depth of the capillary beds. She had learned it all today in this cargo hold, one patient at a time. "You have been bleeding for 2 hours, and you said nothing. You were busy." "You are the most," she searched for the word. In Toranni, the closest concept was Kethval, one who places the herd's survival above their own to a degree that becomes a form of insanity. It was not a compliment. It was a diagnosis. "Stubborn," Colton offered. "Pathologically selfless." "I'll take it." In the 6th hour, a second crisis emerged, not medical but structural. The ventral hull plates, weakened by the mine blast and 7 hours of thermal cycling as the ship drifted between sunlight and shadow, began to delaminate. The cargo hold shuddered. Metal groaned somewhere below them, a sound that Valith felt in her chest bones. Dahar, who should have been lying still with her chest tube draining, sat up. "That's plate 17, she said. "I welded it. The weld is failing." "You cannot," Valith began. Dahar was already standing. One of the able-bodied crew, a mechanic named Briggs who had second-degree burns on his forearms and had been helping Valith hold patients during procedures, caught her arm. "I'll go," Briggs said. "Tell me what to do." Dahar talked him through it from across the hold, her voice carrying with the flat authority of someone describing her own house. "Plate 17, Junction 4, re-weld the lateral seam and brace it with the cargo strut from Bay 6. Briggs went, welding torch in his burned hands, and he sealed the plate in 9 minutes while the ship groaned and flexed around him. When he came back, his burns were worse. He did not mention them. Valith treated them anyway, because she was beginning to understand that humans would not ask, and a doctor who waited for permission would lose every patient in the room. The Resolute docked 40 minutes later. The Terran medical team came through the docking collar in a wave of efficiency that Valith would remember for the rest of her career, not because they were faster than her or more skilled, but because of the sheer, overwhelming scale of the response. The frigate carried 60 medical personnel, a full surgical suite with 12 operating tables, regenerative therapy bays calibrated for every tissue type in the human body, a blood bank stocked with 11 blood types and a synthetic plasma reserve, pharmaceutical stores that dwarfed Kethsaren's entire inventory, diagnostic equipment that could map a human body at the cellular level in 4 seconds, portable life support units that could sustain a critically wounded patient through transit to a definitive care facility, and spares. Spares of everything: clamps, sutures, splints, drugs, fluids, bandages, as if someone had designed the ship around the assumption that everything would go wrong and the only acceptable failure mode was running out. The team lead was a Commander Patel, a compact woman with calm eyes and a voice that carried without being raised. She assessed the cargo hold in 30 seconds, deployed her teams in 60, and was at Valith's side in 90. Surgeon Ascendant Valith, I'm Commander Patel, Chief Medical Officer, Resolute. My team will take over patient care. Can you brief me on what you've done here? Valith briefed her. She went through every patient, 30 surviving, 1 lost, all treated with improvised protocols and equipment she had adapted in real time for a species she had never studied. She described the defibrillation with the modified power cable. She described the hemostatic failures, the atmospheric compromise, the splenic rupture she could not repair. Patel listened without interrupting. When Valith finished, the human commander was quiet for a moment. You performed 31 field surgeries on an alien species with no prior experience, no species-specific equipment, and a failing ship around you, Patel said. You lost one surgeon out of 31. I should not have lost any. With what you had, you shouldn't have saved this many. Patel's voice was steady and sure. Surgeon Ascendant, I have human doctors with 20 years of experience who could not have done what you did today, and they know the species. Valith did not know what to say to that. Patel turned to coordinate the evacuation. Her team moved through the cargo hold with the precision of people who did this constantly, who trained for exactly this, who had ships built for exactly this, who had chosen a profession that existed for the sole purpose of going where things had gone wrong and making them less wrong. The wounded were transferred to the Resolute one by one, on proper stretchers with proper equipment and proper drugs and proper everything. Valith watched each transfer and felt something she could not name, a complex emotion that lived in the space between relief and humility, and a fierce, unwanted admiration. Ensign Park went past on a stretcher, her wrapped hands elevated. She looked at Valith and said, "Thank you, surgeon, for everything." "Your hands," Valith said, because she could not help herself. "The Resolute has regenerative capabilities that I could not provide. Commander Patel believes the prognosis is favorable." Park looked at her bandaged hands. "If I can hold a wrench again, I'll call it a win." She paused. "If I can't, I'll learn to hold it differently." It was such a human thing to say. Not defeat, not denial, adaptation. The same stubbornness that had made Park grab a superheated plasma conduit, expressed now in the quiet declaration that she would simply find another way. Valith added it to the growing file in her mind, the one labeled things about humans that I did not learn in school. Crewman Holt, strapped to a spinal board, managed a nod. "You kept us going, Doc, when nobody else could have." Ortega, the man with the compound femur fracture, was carried past with his leg immobilized in the cargo strut splint Valith had built. He caught her eye and gave her a thumbs up, a human gesture she did not recognize but whose meaning was clear from context. The apprentice with the concussion walked past under his own power. He stopped in front of Valith, stood as straight as his injured leg allowed, and said, "Ma'am, I want to learn Toranni medicine. Can I apply to your program?" Valith blinked. "You are a 17-year-old engineering apprentice with a concussion." "Yes, ma'am, but I can learn." She looked at him, this child who had spent 7 hours in a failing ship carrying water to dying people, because someone had told him that helping was his job. And she thought about what Colton had said about training for everything going wrong at once. "Ask me again when your concussion clears," she said. "I will consider it." He nodded, satisfied, and walked onto the Resolute. Sergeant Vasquez, the burn gel woman, was unconscious on her stretcher, but someone had tucked a thermal blanket around her with a care that suggested she would hear about what the alien surgeon had done when she woke up. Colton went last. He insisted on it. He stood by the docking collar as his people were carried past him, and he said something to each one, a name, a word, a nod. When the hold was empty except for Valith and the place where Garrett had died, Colton looked at her. "Surgeon, warrant officer, I owe you something." "You owe me nothing. I am a doctor." "Then I owe your profession something. 30 of my people are alive because you didn't know our biology and you figured it out anyway." He paused. "I've seen combat medics freeze when the casualties are their own species. You didn't freeze on strangers." "It is what we train for." Colton almost smiled. "Yeah, I said the same thing, didn't I?" He walked through the docking collar under his own power. One arm, 7 hours on his feet, bleeding for 2 of them. He did not look back, because looking back was apparently not something humans did. Valith stood in the empty cargo hold for a long time. Patel invited her to stay aboard for the transit back to Kethsaran. She accepted because her shuttle's fuel cells were marginal, and because she needed to see the end of this. She walked the Resolute's corridors and saw what a species built when it took the business of saving its own seriously. The ship was not a warship retrofitted for medicine. It was a medical vessel from the keel up, designed by people who understood that the most important ship in a fleet was not the one that fired the biggest guns, but the one that arrived after the guns went silent. The corridors were wide enough for 3 stretchers abreast. The lighting was calibrated for surgical precision, clean white, with no chromatic distortion. The bulkheads were coated in antimicrobial composites. Even the air was different. Filtered, humidified, temperature-controlled to a range that optimized human healing. The Resolute's medical bay was a cathedral of competence. Every station was equipped for human physiology. The drugs were right, the clamps were right, the imaging was right. Valith walked the wards and saw her improvised treatments being replaced by proper ones. And she felt no resentment, only the quiet satisfaction of knowing that what she had built with wire and guesswork had held long enough. Patel found her in the observation alcove, looking out at the debris field. The mines had expended themselves. Every last one of the 70-year-old weapons had either detonated or been neutralized by the Resolute's ordnance disposal team, who had swept the field as casually as Toranni groundskeepers clearing fall growth. The wreckage of the escort frigate drifted in silence, backlit by starlight filtered through the system's thin dust veil. 38 crew. 38 humans who had died so that the transports could live. "We've already dispatched a recovery corvette," Patel said, standing beside her. "Everyone, we don't leave people behind. Even the dead." "Especially the dead." Patel was quiet for a moment. "Captain Marchetti, the frigate commander. I served with her 6 years ago on a relief convoy in the Pelith sector, famine response. She ran 16-hour shifts organizing food distribution, then slept on the deck of the cargo bay because she gave her cabin to a family with children." Another pause. "She would have done exactly what she did today. Put the ship between the mines and the transports. She wouldn't have hesitated." "That is not rational behavior." "No, it's what we are." Valith considered this. On Toranni, the dead were released to the soil cycle within hours. The body was a vessel, Once emptied, it was returned to the earth. The idea of crossing a minefield to recover an empty vessel was, by Toranni logic, irrational. Everything about these people was irrational. "Commander Patel," Valith said, "I have a question." "Go ahead." "Your species, you run at a core temperature that any Toranni physician would classify as a permanent low-grade fever. Your blood is iron-based, which is a less efficient oxygen carrier than copper. Your regenerative capacity is slow by galactic standards. You have no secondary respiratory system. You have one heart." She paused. "By every metric, you are fragile." Patel waited. "But I watched a woman grab a superheated plasma conduit with her hands to save 41 people. I watched a man with one arm stand for 7 hours directing triage. I watched your wounded refuse treatment so others could be treated first. I watched your dead crew absorb mine strikes so your civilians could survive." Valith's ridge plates settled against her skull, the Toranni expression of deep respect that was usually reserved for the dead. "You are, by every metric, impossible." Patel was quiet for a long time. Then she said, "We just don't know when to quit." "That is not an explanation." "No, it's the truth." They stood in silence, watching the debris field. After a while, Patel spoke again. "You know what I'm going to recommend to Terran Fleet Medical?" "No." "That we station a permanent human medical liaison at Kethsaran. And that we ask you to train them in Toranni surgical technique." Patel looked at her. "And that we send you everything we have on human physiology. Full anatomical database, pharmacopoeia, surgical protocols. The stuff that's not in the Galactic Index because we never got around to submitting it." "You never submitted your own medical data to the Galactic Index." "We submitted a summary. The full database is about 40 terabytes. The index said it was disproportionately large for a single species." Patel's mouth twitched. "They weren't wrong. 40 terabytes of medical data for a single species. The entire Toranni medical library, covering all 12 Toranni subspecies, their 16 allied species, and 400 years of surgical development, occupied 22 terabytes. The humans had nearly double that for one species." "Disproportionate," Valith repeated. "We break in a lot of different ways. We needed a lot of solutions." Patel turned from the viewport. "Let me show you something." She led Valith to a compartment near the ship's bow, a small room lined with sealed cabinets, each labeled with a type of medical emergency. Trauma, burns, chemical exposure, radiation, decompression, biological contamination, cardiac, neurological, obstetric, pediatric, geriatric. And then a second row, mass casualty, triage, field amputation, cold weather injury, heat injury, altitude, submersion, crush syndrome. 26 categories. Each cabinet contained a complete, self-contained treatment module, designed to function independently of the ship's main medical bay. "Every Terran medical frigate carries these," Patel said. "We call them crash kits. Each one assumes total system failure, no power, no scanners, no pharmacy access, no support staff. Just the kit, the patient, and whatever you know. You designed your medical ships to function when everything has already failed. We designed them for the worst day anyone will ever have, because that's the day they need us most." Valith opened one of the cabinets. Inside was a field surgical set: scalpels, retractors, clamps, sutures, pre-measured drug vials, a hand-cranked suction device, a manual ventilation bag, and a folded instruction card written in 3 languages, and illustrated with anatomical diagrams so clear that a first-year student could follow them. "Who uses these?" Valith asked. "Anyone who's left. Could be a surgeon. Could be a cook who took a first aid course 6 years ago. The kits are designed so that anyone with hands and basic literacy can save a life." Valith closed the cabinet. She stood in the small room surrounded by 26 preparations for catastrophe. each one a testament to a species that had looked at the universe's capacity for destruction, and answered it not with weapons or shields, but with laminated instruction cards and pre-measured drug vials, and the assumption that someone, somewhere, would need to save someone else with nothing but their hands and what they had been taught. "You are a remarkable species," Valeth said. "We're a species that gets hurt a lot," Patel said. "Remarkable is what we built around that fact." The Resolute reached Kethsaran at the end of the 9th hour. Valeth's students had performed admirably in her absence. Rethea had handled 3 additional critical cases with steady hands and only a moderate degree of panic. The station was crowded, strained, and functioning. Patel's team transferred the transport 2 casualties to the Resolute's long-term care ward. The ship would carry them to a Terran medical facility for definitive treatment regeneration for Park's hands, spinal repair for Holt, reconstructive surgery for Colton's arm, chest wall repair, and lung reconstruction for Dahar. Things that Kethsaran could not do, and that the Resolute could not do in transit, but that the Terran medical infrastructure could do, because they had 40 terabytes of knowledge about how their own species broke and healed. Valeth was present when they brought Myra to the Resolute. Thesic carried the child from Kethsaran's waiting area, where she had spent 7 hours sitting quietly with the same flat-eyed composure that Valeth had first seen in the supply alcove. Myra had not cried. She had not asked for food, though Thesic had offered it 3 times. She had sat and waited with the patience of someone who had been told that waiting was the only useful thing she could do. When Thesic set her down on the Resolute's transfer deck, Myra stood very still. She looked at the medical bay doors. She looked at Valeth. Then she looked at the stretcher being wheeled through from the port corridor. Dahar was awake. The chest tube was draining into a portable unit. Her ribs were properly immobilized, and her welding-burned hands were wrapped in the Resolute's regenerative bandages. She looked diminished, smaller than the woman who had welded hull plates shut with broken ribs and a collapsing lung. But her eyes were open, and they found her daughter across 30 meters of transfer deck. "Myra." The child did not run. She walked, steady, measured, across the deck between the medical personnel and the stretcher teams and the equipment carts, and she climbed onto the edge of her mother's stretcher and lay down against her uninjured side and closed her eyes. Dahar put her wrapped hand on her daughter's back. Neither of them said anything else. They did not need to. Valeth watched this from the transfer deck threshold, and her ridge plates did something they had not done since she was a student at the ascending halls. They flushed violet at the edges, the Toranni involuntary response to witnessing something that exceeded the emotional range the species had words for. Not grief, not joy, something older than both. Before the Resolute departed, Colton came to find Valeth. He was in a medical gown now, his stump properly dressed and bandaged by his own species doctors with the correct materials, the correct compounds, the correct everything that Valeth had spent 9 hours substituting for with wire and guesswork, and the stubbornness she was beginning to suspect she had contracted from her patients. He looked smaller without the uniform, tired, older. The lines around his eyes were deeper than they had been that morning, and his remaining hand had a fine tremor that spoke to how close to collapse his body had been for the last several hours. But his eyes were still clear, still that impossible brown, still undimmed. "Surgeon Ascendant." "Warrant Officer." He held out his remaining hand. Valeth looked at it. She had read about this human gesture, a clasping of hands that signified greeting, agreement, respect, farewell. Her primary right hand could have crushed his. She took it gently instead, and his grip was warm and firm despite everything. "If you ever need anything," Colton said, "anything at all, you put out a call and I will answer. Personally, you will be in rehabilitation for months. Then I'll answer from rehab." He released her hand. "Fair warning, Surgeon, you have about 30 people on this ship who feel the same way. You're going to get a lot of messages." He turned and walked back toward the Resolute's boarding ramp. At the threshold, he stopped and looked back over his shoulder. "Hey, surgeon." "Yes." "For someone who'd never seen a human before today, you did okay." "Okay," Valeth repeated. The word felt insufficient in every language she spoke. "Thank you, warrant officer." He nodded once and was gone. Valeth returned to Kethsaren's medical bay. It was quiet now, the kind of quiet that follows a storm, when the surfaces are still wet and the instruments are still warm, but the crisis has passed. Her students were cleaning, restocking, replacing the supplies they had burned through. The simulation mannequin lay in the corner where she had kicked it, still wearing its exercise tags. She picked it up, brushed it off, and set it back on the training table. Then she sat down at her desk, opened a new file in the station's medical log, and began to write. Medical log, Kethsaren Station. Surgeon Ascendant Valeth, Toranni Medical Corps reporting. At 3:47 station time, a mass casualty event interrupted a scheduled training exercise. A Terran civilian convoy struck a derelict minefield in the Damara corridor. 109 survivors were received across Kethsaren Station and the crippled transport too. 108 of those survivors are alive as of this entry. One was lost crewman Garrett, splenic rupture, untreatable with available equipment. I take responsibility for that loss. I have today treated more human casualties than any Toranni surgeon in the history of the Corps. I was not prepared. I was not equipped. I was not trained for their biology, their physiology, or their pain tolerances. I was also not prepared for the patients themselves. Addendum to the Toranni Medical Index filed under Species 7702 Terran, subsection, Field Observations. Humans are, by standard galactic medical metrics, one of the more fragile sapient species in the index. They have a single cardiovascular pump. They lack secondary respiratory organs. Their blood carries oxygen on iron, which is thermodynamically inferior to copper-based transport. Their tissue regeneration is slow. Their skeletal structure, while dense, fractures under forces that most galactic species would absorb without injury. None of this matters. What matters is that when everything breaks, when the hull fails and the air thins, and the equipment is wrong, and the doctor has never seen your blood before, humans do not stop. They do not lie down. They close plasma relays with their bare hands. They stand for 7 hours on one arm and 2 hours of hidden bleeding. They give their blankets to the person next to them and shiver in the cold and call it teamwork. They are impossible patients. They deny their injuries. They prioritize others over themselves with a consistency that, if it were observed in any other species, would be classified as a behavioral disorder. They are also the reason 30 of them walked off that ship alive. I am requesting the full Terran medical database from Earth, all 40 terabytes. I am restructuring the Kethsaren curriculum to include a complete Terran physiology module. I am filing a formal recommendation that every Toranni field hospital in the Damara corridor be equipped for human casualties, effective immediately. This includes iron-based hemostatic compounds, human-gauge vascular clamps, biphasic defibrillation equipment, and analgesics calibrated for a species with a baseline body temperature of 37 degrees Celsius, and a pain tolerance that defies every scale in the Galactic Medical Index. I am also filing a personal request with the Toranni Ascending Halls to add Species 7702 Terran to the mandatory surgical practicum, not as an elective, not as a supplemental module, as a core requirement, alongside Toranni anatomy and allied species physiology. The rationale is simple. Today, a Terran civilian convoy was destroyed by weapons that should have been cleared from this corridor 50 years ago. The galaxy's mine clearance protocols failed them. The Galactic Distress Network routed their beacon to a station that had never treated a human patient. Their own escort frigate died so that they could survive long enough for help to arrive. And when help arrived, it was a Toranni surgeon with the wrong tools, the wrong drugs, the wrong training, and no excuse for any of it. I do not intend to be unprepared again. Not because it is likely we will see another incident like today, but because if we do, when we do, I intend to lose no one. Final note: Crewman Garrett's death will be reviewed under standard Toranni mortality protocols. I will not accept the notation of unavoidable that my superiors will inevitably apply. The death was avoidable. The correct clamp existed. It was on a ship that arrived 2 hours after he died. I will carry that. It is what surgeons do. Surgeon Ascendant Valith, Toranni Medical Corps, Kethsaran Station. End log. She closed the file and saved it to the station's permanent record. Then she reviewed it once, checking the clinical language, the precise descriptions, the measured tone that was expected of a Toranni medical log. It read like what it was: a formal record of a mass casualty event, written by a professional who had performed her duties under adverse conditions. It did not capture what it had felt like: the smell of iron blood, the heat of human skin under her hands, the way Colton's jaw clenched when the pain broke through, and the way it unclenched deliberately when he decided the pain did not matter, the sound of Myra's silence, the hiss of air escaping Dahar's chest, the flat crack of the improvised defibrillator discharging into Vasari's heart, the apprentice asking to study medicine with a concussion and a limp, and the unshakable conviction that learning was always the right answer. She did not add any of that. Medical logs were for facts. The rest she would carry in the place where Toranni surgeons kept the things that facts could not hold. Then she sat in the quiet for a moment, her 6 hands folded in her lap, her ridge plates flat and still. The simulation mannequin on the training table stared at the ceiling with its blank composite eyes. It was designed to simulate Toranni casualties. It had a copper-based circulatory system, 4 lungs, and a body temperature 12 degrees cooler than the patient's Valith had spent the last 9 hours treating. She reached over and pulled it off the table. She opened the storage locker, found the materials request terminal, and began typing. Request: 1-1 human anatomy simulation mannequin, full scale, with iron-based circulatory system, single pump cardiac model, monopulmonary respiratory simulation, and core temperature calibrated to 37 degrees Celsius. Priority: immediate. Justification: training exercise preparedness. Additional note: also requesting supplemental mannequin accessories including simulated fracture modules, burn simulation overlays, and 1 detachable limb assembly. They train for everything going wrong at once. We should too. She submitted the request, turned off her desk lamp, and walked to the viewport. Outside, the Resolute was pulling away from Kethsaran, its running lights bright against the pale dust of the Damara corridor. Somewhere inside that ship, Colton was lying in a proper medical bay with proper drugs and a proper surgeon, and the stub of an arm he had refused to acknowledge for 7 hours. Somewhere inside, Park was looking at her bandaged hands and wondering if she would hold a tool again. Somewhere inside, 30 people were alive because an alien doctor had figured out their impossible biology 1 patient at a time, with the wrong equipment and the wrong training and the right instinct. Valith pressed one of her secondary hands against the viewport glass, a gesture she had seen Colton's people make. She realized, when they watched something leave, that they were not ready to release. The Resolute's engines flared soft blue, and the frigate slid into the corridor and was gone. Valith lowered her hand, her ridge plates settled. She turned from the viewport, walked back to the medical bay, and began preparing for the next drill. Except this time, when she set up the triage stations, she left space for the mannequin she had ordered. The one that ran hot, the one with iron in its blood and a single, stubborn heart. The one that would teach her students what she had learned today. that the most fragile species in the galactic index was also the hardest to kill, and that the difference between those two facts was everything that mattered in medicine. The training exercise had gone wrong that morning. Valith was beginning to suspect it had gone exactly right. She picked up her instruments, called her students to the bay, and started again from the beginning.